Are you due to sit SCA? Maybe you've been thinking about this exam and you're stressed. In this video, I'm going to share with you insights how to prepare so you can pass this exam. The purpose of the SCA is to assess the GP trainee's ability to integrate and apply clinical, professional, and communication skills appropriate for general practice. Trainees sitting simulated consultation assessment will be assessed over 12 simulated consultations. These are cases that will be performed by calibrated role players. The exam is taken in the trainee's local surgery remotely. The case selection of SCA reflects modern general practice. Candidates will be tested on the ability to manage risk, uncertainty, how to use time as a tool, how to manage medical complexity and multiple problems. Among the 12 cases, there will be a case involving patient less than 19 years old, gender, reproductive and sexual health, long-term condition, mental health, urgent and unscheduled care, health disadvantage and vulnerabilities, older adults, ethnicity, culture, diversity, inclusivity. For example, this might include a migrant or a refugee and the social implications of them accessing healthcare, new presentation of undifferentiated disease. This might test a candidate's ability to manage uncertainty and how to manage risk, prescribing, investigational results, and last but not least, professional conversation or professional dilemma. This might involve a healthcare professional who might be suffering from burnout and the implication of the ability to practice. Trainees will get 3 minutes reading time before starting the consultation. They will have access to the briefing of the case and the case notes. The cases in SCA are based on telephone consultations, but in majority of these, candidates will be able to see the simulated patient. Some cases will be audio only. Trainees will be assessed under 3 domains: data gathering and diagnosis, clinical management and medical complexity, and relating to others. Each of these 3 domains will be awarded clear pass, pass, fail, or clear fail. Clear pass is awarded when the candidate has demonstrated above the standard of a newly qualified independent GP. A pass is awarded if this domain is sufficiently demonstrated at the standard of a newly qualified independent GP. A fail is when the candidate has not sufficiently demonstrated the standard of a newly qualified independent GP. Clear fail is when the domain is clearly demonstrated to be below the standard of a newly qualified independent GP. The passing level for data gathering and diagnosis is when the candidate demonstrates to have systematically gathered and organized relevant and targeted information to address the needs of the patient and their problems. Keywords in this sentence include relevant and targeted information. So it's very important that the data gathering is focused, the candidate is gathering and organizing relevant and targeted information so that they can address the needs of the patient and the problem. Adopt a structured and informed approach to problem solving, generating an appropriate differential diagnosis or relying on first principles where the presentation is undifferentiated, uncertain, or complex. I suspect in some cases there will be a clear diagnosis. So what the examiners are testing is the ability of the candidate to manage uncertainty and how they can still manage the patient safely and make a plan if they don't know what's a working diagnosis. So it's really important, if you've gathered the data and you're still not sure about your working diagnosis, you're honest and explain what you're going to do to find out and to get to the bottom of this. To pass in clinical management and medical complexity, candidate needs to demonstrate the ability to formulate safe and appropriate management options, which includes effective prioritization, continuity, and time and self-management. Keywords in this sentence include safe and appropriate management options. So there might be cases when you might have to effectively prioritize because you won't have enough time to address everything, but you need to be safe at the end of the consultation. So if, for example, you're not able to manage everything, then it might be worth to consider a follow-up to ensure continuity of care and to manage the issue, possibly in a second consultation as a follow-up. Demonstrates commitment to provide optimum care in the short and long term, whilst acknowledging the challenges. This used to be interpersonal skills domain in the RCA and CSA. The difference that we've got here is it's about communicating in a person-centered way To obtain a pass in relating to others, candidate needs to demonstrate ethical awareness, show ability to communicate in a person-centered way, demonstrate initiative and flexibility in using various consultation approaches in order to overcome any communication barriers to reach a shared understanding with the patient. So this is about being flexible in your approach and not having a one-size-fits-all. So sometimes candidate might have a formulaic approach. This is where you can use your personality and consult using your own style to be able to communicate with the patient and relating to the problems so that you can reach a shared understanding with the patient. In addition to the marking of individual domains, examiners will also be judging the candidate's general performance in each case. The 4 global standard settings: pass, bare fail, and fail. Pass is when the candidate clearly meets the criteria, knowledge, standard desired for an independent, newly qualified GP who is safe to practice. Bare pass is when there might be minor errors or omissions, but generally a good performance and will be fit to practice. Bare fail is when the candidate presented some evidence but insubstantial or incomplete, not done enough to demonstrate fitness to practice. Fail, minimal evidence presented or potentially puts the patient in danger. The mark of the individual domains and the general performance for each case are then carried forward to determine the pass mark for the case. This is done through a standard setting process known as borderline regression. In other words, there's no fixed pass mark for each case. The borderline regression method is an established and appropriate model of standard setting for medical or SCA types examinations. So let me give you an example how borderline regression works. So you've got the y-axis, which would be the checklist score, and it's a percentage, and then the global score, where the candidate would be assessed globally whether they fail, have barely fail, barely pass, or have pass. Pass mark is determined by using borderline regression. Let's say we want the pass mark to be just in between the bare pass and bare fail. So then you draw a line from there, and then we'll get the pass mark on the y-axis. If a case is easier, then more candidates are going to score higher. When we determine the pass mark, then using the borderline regression method, the pass mark might also be higher. If you found this video useful so far, you might be interested to download a free copy of the SCA Blueprint, where I go in much more detail how you can plan your preparation. Click the link down in the description below to download your free blueprint. Let's look at the feedback statement. Compared to the RCA, there has been many changes to the feedback statement. It's vital that you study the feedback statement for each domain because each word have been put there for a reason. What's interesting here is that examination doesn't form part of the feedback statement. So examiners are not really assessing the candidate's ability to examine a patient. It's more related to the ability to take a history and make a safe assessment. So using red flags to elicit any signs of serious pathologies, considering the person as a whole, eliciting psychological or social information, which is done in context. Generation of functional solutions for data gathering when presented with multiple problems and complex problems is about how you set the agenda in the consultation so that you're managing according to the priority of the case. So we're seeing a lot of patients who are presenting with multiple problems, who have complex issues. So it's very important that you provide a solution for how this is going to be addressed in the 12 minutes that you've got. So sometimes you might find that you might not be able to address everything, but then you need to have a negotiation with the patient to agree as in what's the agenda for this consultation based on the priority, and then you provide a solution how you're going to manage the other problems which might need possibly another consultation, for example, or if it's something urgent, then it might need to be addressed on the same day. Next is a domain for clinical management and medical complexity. As you can see, there's quite a lot of statements. A change from the RCA is that now investigation is part of clinical management. It's important to highlight that investigations need to be targeted. So sometimes registrars might be arranging a battery of tests. If you're arranging inappropriate or untargeted investigations, then examiners might not be scoring you very well for clinical management because you're not discriminate. A new statement that I'd like to bring to your attention is inappropriate and or insufficient use of time as a management tool. In general practice, we deal with a lot of uncertainty, and sometimes we might need to use time as a management tool. So for example, if you're not sure about something, but you have ruled out anything serious, then you can use time as a management tool where you tell the patient if they do have X, Y, or Z to represent, but you arrange a follow-up maybe in a week time, and then you can reassess and see whether there's any changes. Another statement worth bringing to your attention is management options were unresponsive to circumstances and preferences to those involved. So this is about how you can formulate a management plan that is personalized, tailored to your patient. Sometimes registrars will formulate a generic management plan that they would say to every patient presenting with headache or diabetes. So it's very important that you use the information that you have gathered in data gathering, and then you integrate that information so that you can formulate a management plan that takes into account the patient's circumstances and preferences. The next statement is management options were unprioritized in regard to perceived risk. This statement is about how you manage risk and the urgency to which your management options is addressing these issues in the consultation. So you need to have a very good prioritization so that if something is risky, you're managing that risk at the level that it needs to be. The next statement is how you show evidence of coherent management plans for complexity or multiple issues. The last statement is health improvement, rehabilitation, prevention, and health promotion were absent or insufficiently encouraged. In some of the cases, you might need to educate the patient and offer opportunistic health promotion advice. This statement might not be relevant for all the cases in the SCA, but in some cases, it would be expected that you discuss health improvement, prevention, and consider what the patient could be doing themselves to encourage them to adopt a healthy lifestyle. The last domain, relating to others, has 14 feedback statements. It might look daunting to have to go through everything, but it's very important that you study these statements. Now you have more clarity as in what examiners are looking for so that they can score you in relating to others. So it's about making sure that you know exactly what you should be demonstrating in the cases. Explanations were insufficiently adapted to the patient's context and level of understanding. So this is about not using medical jargons or technical words. Oftentimes when registrars explain a medical problem or their plan, they might use language that the patient doesn't understand. So it's important to calibrate the level of understanding of your patient so that you explain it in a very simple term. In some cases where there might be complexity or multiple issues, then it's important that you consider what are the things that you can do for this patient, and then maybe you might need to involve your team. So we're seeing a shift in general practice where we're using allied healthcare professionals, and it's important that you know who are the other people who can help for the management of this patient. So involving of the team members so that if a patient has got complex medical problems and needs, then you're offering the right set of treatment and support. The earlier you prepare, the better. Start preparing at least 6 months before the exam. Learn how to manage risk and uncertainty. Develop your skill at managing medical problems. You can practice cuts targeting SCA case selection. Use nice CKS and PALS reference to prepare your cases. To pass the SCA, it's very important that you go through this iterative cycle. So you consult, you self-assess and reflect on your consultation, seek feedback, Adjust what's not working in your consultation and refine it, and then implement that in your next consultation. And the more you go through this cycle, the better your consultation skills will get. Here are some practical tips to help you. Consider forming study groups and bring your own case scenarios based on real life for role plays with colleagues. Make sure that these cases fall under the SCA selection. Record yourself during practice and listen back to your consultations. Seek constructive feedback so you can identify any shortcomings and refine your consultation. It may be helpful to practice 6 or even 12 consecutive simulated role plays as a mock before the exam. Consider joining our Facebook SCA support group. I will be posting more resources and practical tips on the Facebook group. If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.